Hello everyone. Today we are going to inspect nose, mouth and pharynx and neck. So before we start our examination, we'll make sure that we have all the necessary equipments like otoscope with largest speculum, a square gauze, gloves and a tongue blade. Now we'll proceed towards our examination. Hello.
Hi,
What is your name?
Sunita Madhukar,
And what is your age?
42 years.
Okay. So today I am going to inspect your nose, mouth and pharynx and neck. So we'll start with nose first. So first I'll inspect your anterior and inferior surface of the nose.
Okay.
Gentle pressure on the tip of the nose with your thumb usually widens the nostrils. Use a pen light or otoscope light to obtain a partial view of each nasal vestibule. If the nasal tip is tender, be gentle and manipulate the nose as little as possible. Note any asymmetry or deformity of the nose.
Now I'll do a test for nasal obstruction.
Okay.
Press on each ala nasi in turn and ask the patient to breathe in.
Will you please breathe in now? No. Okay. Again. Okay. Now I'll inspect the inside of your nares.
Inspect the inside of nares with an otoscope and the largest available ear speculum. Tilt the patient's head back a bit and insert the speculum gently into the vestibule of each nostril to avoid contact with sensitive nasal septum. Hold the otoscope handle to one side to avoid the patient's chin and improve your mobility. By directing the speculum posteriorly, then upward in small steps, try to see the inferior and middle turbinates, the nasal septum, and the narrow nasal passage between them. Some asymmetry of two sides is normal.
Inspect your nasal mucosa.
Note the color, any swelling, bleeding, or exudate of the nasal mucosa. If any exudate is present, note its character, whether it is clear, mucopurulent, or purulent.
Now I'll inspect your nasal septum.
Okay.
Note any deviation, inflammation, or perforation of the septum.
Now we'll conclude your nasal examination by inspecting the sinus.
Okay.
Press upon the frontal sinuses from under the bony brows, avoiding pressure on the eyes. Then press up on the maxillary sinus.
So now I'll inspect your mouth and pharynx.
Okay.
So before inspection, will you please remove your lipstick? Now I'll inspect your lips.
Observe the color and moisture of the lips. Note any lumps, ulcers, cracking, or scaliness.
Now I'll inspect the inside of your mouth. So will you please open your mouth?
Look at the patient's mouth with good light and with the help of the tongue blade. Inspect the oral mucosa for color, ulcers, white patches, and nodules.
Now I'll inspect your teeth and gums.
Note the color of the gums, which are normally pink. Brown patches may be present, especially but not exclusively in dark-skinned individuals. Note if any teeth is missing, discolored, misshapen, or abnormally positioned. To assess tooth, jaw, or facial pain, palpate for the teeth for looseness and gums with your gloved thumb and index finger.
Now I'll inspect the roof of your mouth. So will you please open your mouth?
Inspect the color and architecture of the hard palate.
Now I'll inspect the tongue and floor of your mouth.
Here, inspect for the symmetry, which is the test of hypoglossal nerve. Note the color and texture of the dorsum of the tongue. Inspect the entire oral cavity, especially the sides and undersurface of the tongue and the floor of the mouth, areas where cancer often develops. Note any white or reddened areas, nodules, or ulceration. With your right hand, grasp the tip of the tongue with a square gauze and gently pull it to the patient's left. Inspect the side of the tongue and then palpate it with your gloved left hand, feeling for any induration. Reverse the procedure for the other side.
Now I'll inspect your pharynx and soft palate, which is the test of vagal nerve. So will you please say ah?
As the patient says ah, the soft palate should rise symmetrically and uvula should stay in middle. Alternatively, you can press a tongue blade firmly down on the midpoint of the arched tongue, back far enough to visualize the pharynx, but not so far that you cause gagging.
Inspect the soft palate, anterior and posterior pillars, uvula, tonsils, and pharynx. Note their color and symmetry and look for exudate.
So now I'll inspect your neck.
Inspect the neck, noting its symmetry and any masses or scars. Look for enlargement of the parotid or submandibular glands and note any visible lymph nodes. Palpate the lymph nodes. Using the pad of your index and middle fingers, press gently, moving the skin over the underlying tissues in each area. The patient should be relaxed with the neck flexed slightly forward and if needed, turn slightly toward the side being examined. Note the size, delimitation, mobility and consistency or any tenderness. Palpate the preauricular nodes with a gentle rotatory movement. Then examine the posterior auricular and occipital lymph nodes. Then palpate the tonsillar lymph nodes which are at the angle of the mandible, submandibular which is midway between the angle and the tip of the mandible, submental in the midline a few centimeters behind the tip of the mandible, superficial cervical which is superficial to the sternocleidomastoid, and posterior cervical along the anterior edge of the trapezius. Palpate the anterior superficial and deep cervical chains located anterior and superficial to the sternocleidomastoid. Flex the patient's neck slightly forward towards the side being examined. Examine the supraclavicular nodes in the angle between clavicle and sternocleidomastoid.
Now I'll inspect your trachea and thyroid gland.
Inspect and palpate the trachea for any deviation. Place your fingers along one side of the trachea and note the space between it and the sternocleidomastoid. Compare it with the other side. The spaces should be symmetric.
Now I'll start examining your thyroid gland by inspecting your neck.
Tip the patient's head slightly back. Using the tangential light directed toward the tip of the patient's chin, inspect the region below cricoid cartilage to identify the contour of the gland.
Now I'll observe you swallowing water. So what you have to do is take a sip of water, then extend your neck and then swallow. Okay?
Watch for the upward movement of the thyroid gland, noting its contour and symmetry. The thyroid cartilage, the cricoid cartilage, and the thyroid gland all rise with swallowing and then fall to the resting position.
Now I'll palpate your thyroid gland and look for goiter or enlargement of lobes. Now just flex your neck.
Now move behind the patient and place the fingers of both hands on the patient's neck so that your index fingers are just below the cricoid cartilage. Ask the patient to sip and swallow water as before. Feel for the thyroid isthmus rising up under your finger pads. It is often but not always palpable. Displace the trachea to the right with the fingers of the left hand. With the right hand fingers, palpate laterally for the right lobe of the thyroid in the space between displaced trachea and relaxed sternocleidomastoid. Find the lateral margin. In similar fashion, examine the left lobe. Note the size, shape, and consistency of the gland and identify any nodules or tenderness. If the thyroid gland is enlarged, listen over the lateral lobes with a stethoscope to detect a bruit, which is a sound similar to cardiac murmur but of no cardiac origin. In this way, nose, mouth, and neck are examined. So now record your findings. Thank you.